All right, so my name is Anthony Marois. I'm an orthopedic sports medicine specialist here at EmergeOrtho. So bursitis is a blanket term for inflammation of soft tissue. That's the blanket term for what bursitis is. You can have bursitis over several different areas. You can have bursitis in your shoulder, you can have bursitis in the front of your knee, and you can have bursitis over the side of your hip. So there's a lot of places you can have what's so-called bursitis. Bursitis of the hip, term we use for trochanteric bursitis, which is a bony prominence over the side of your hip called your greater trochanter. There's some tight soft tissues and some tendons that can be irritated, and there's what's called a bursa, or connective tissue, or a soft tissue cushion over those tendons that can become irritated and inflamed. Trochanteric bursitis specifically is bursitis or inflammation of the bursa over the side of the hip, or the greater trochanter, which is part of your hip bone. Trochanteric bursitis has many causes. It could be as simple as, you landed on your hip and you inflamed the soft tissues. It could be overuse of the glute muscles. It could be a muscular imbalance or weakness that is leading to overuse of the muscles in that area. Or you could have a muscle tear that is causing inflammation. Hip bursitis is aggravated a lot by doing things where you're standing on one leg, like jogging or going upstairs or walking for long periods of time. So a lot of activity-related pain. And then people also, when they're laying down at night, like laying on their side, will complain of pain when they sleep at night. So often we take a conservative approach at first. A lot of times it does get better with some simple measures. So I think oral anti-inflammatories and physical therapy or home exercises are kind of the mainstay of treatment. Often if you come into the office with hip pain on the side of your hip, I usually offer somebody an injection for acute pain relief to help make therapy exercises a little bit easier. I would see an orthopedic specialist, specifically somebody who does hip surgery, if you have trochanteric bursitis or pain on the outside of your hip that has been not getting better with conservative treatments. You've tried most of the conservative things like anti-inflammatories, therapy, or injections, and your hip pain is just not getting better. Oftentimes, bursitis of the hip that doesn't get better with conservative measures usually means that there is a tear in one of the muscles that often will need an MRI scan and potentially even surgery.